When you've been to as many places and covered as many stories as we have, you tend to take it all in stride. Very little knocks you off your pins. At least that's what we thought, until we found a group of American doctors and nurses 8,000 miles from home doing what they do best, giving little kids the heart, literally the heart, to grow up healthy and happy. It's called Heart to Heart, and it reaches from Oakland, California to St. Petersburg, Russia. Sending a cardiac unit from Oakland Children's Hospital to St. Petersburg Children's Hospital #1 twice a year may not do much for our balance of trade, but it sure is good for our soul. These children are dying. They're so weak, they squat instead of stand, and even have to walk that way. Some can't walk at all. Their parents carry them everywhere. They were born with congenital heart defects, and if they'd been operated on as infants, as they are in America, they'd be leading normal lives. But these are Russian children, and the surgery they need is almost impossible for them to get.
I would say that overall, the majority of them will die because there's very few cardiac centers.
Dr. Christian Hardy is the chief cardiologist for the Heart to Heart team, which is made up of volunteers who come here on their vacations for no pay. He told us that when they first came in 1990, it was like stepping back in time. Russian medicine was about 40 years behind ours.
We saw patients laid out on beds with IVs that weren't sterilely inserted. We saw lack of supplies, reused supplies over and over and over, and we saw children who, with very simple problems, were inoperable and dying.
Molchanov?
One of those children is 8-year-old Sasha Molchanov. Since birth, his parents have been taking him to Russian doctors, begging for medical help, with no success.
He's working real hard.
Dr. Hardy schedules Sasha Molchanov for an operation.
Okay. Any other questions for me?
Without surgery, his life expectancy is only another 3 or 4 years. The Rechet's family had been told repeatedly by Soviet doctors that 2.5-year-old Andrei wouldn't make it to his 3rd birthday.
So it's very common for this to happen with this heart lesion.
They read about the Heart to Heart program and took a 20-hour bus ride to get here.
We have the blood available in.
Dr. Hardy told the family Andrei could finally get the surgery he needed.
We're planning on doing him first thing in the morning.
At last, the day has come when we can have hope that our son can live like other children.
But cardiac surgery is high risk, especially here where the surgeons don't have the diagnostic equipment they need to know ahead of time exactly what they'll find. Andrei's heart was far more damaged than the medical team had suspected. He survived the surgery, but after he was transferred to the intensive care unit, his heart started to fail.
I don't want them to see him like this.
The Americans and Russians teamed up to do immediate emergency surgery on Andrei right there in the intensive care unit.
Vadim, I'd open.
They used our camera light so they could see.
Sats are slowly coming up.
In my opinion, the worst is over. But obviously, he's still very sick, very critically ill.
But the worst wasn't over. Andrei's kidneys began to fail, and the hospital didn't have the diuretics that could have saved his life. The next day, Andrei Rechetz died, and his parents came to say goodbye. Dr. Hardy told us that if he'd been operated on in the United States, he'd probably be alive today.
I take this all very personally. These are all my little kids, all my little children. We get very emotionally attached to the patients that we deal with, and when we lose one, we lose a little piece of us.
Dr. Nilus Young helped start the Heart to Heart program and supervised young Andrei's surgery. What about the results? Have you improved the mortality rates in this hospital? How can you give us some bottom line?
Yeah. Well, I think the bottom line is they would all die if they didn't have surgery. And the results overall have been quite good, somewhere between 85 and 90% of the patients that have been operated on so far, and that's almost 300 patients, are alive and doing well.
One of the sickest children we met was Alexander Panushkin, who spent his days curled up on the floor.
You know, we've seen children who hunker down, they crouch. Are those children that are going to die soon? Is that a sign?
Those children are very sick. I had a little boy run down the hallway Got halfway down the hallway, he started teetering a little bit, and then he squatted down. And I went to find him fanning himself, very blue. And I was actually quite worried at the time. I was afraid he was going to get into deep trouble right there in front of me, and picked him up and took him back to the clinic to examine him. And actually, I've arranged for him to be admitted to the hospital to have his surgery next week.
You okay?
Will he die if he doesn't have the surgery soon?
Absolutely, and probably soon.
For some patients, it's already too late. 11-year-old Ksenia's mother brought her to see the American team, hoping they could fix her damaged heart. But ultrasound tests showed her heart was deteriorated beyond repair.
And my fear is that...
Dr. Hardy has to tell her mother that Ksenia is too sick for surgery.
Given what things look like now, she cannot tolerate a radical repair. She would die for sure.
It's terribly devastating, and I'm never going to get used to this. I'm never going to get to a point where I can accept that this is the way it should ever be.
Our medicine is fantastically poor.
Dr. Mark Silberman, the Russian head of cardiology at the Children's Hospital, works closely with the American team.
We thought that your society was technically advanced, scientifically advanced. But it seems that they put all their resources into the military.
Absolutely.
But how does that make you feel? Angry?
Not angry. Very sad.
Was there no sophisticated medicine being practiced anywhere in the Soviet Union at all?
No, it was for communists, for high-level military men, for somebody else, I don't know.
But just for the top party brass?
Yes.
For the creme of the Communist Party?
Yes. Sour cream, yes.
Sour cream.
The heart-to-heart program started because of one child, 11-year-old Maria Senatova, who is completely healthy now. But 4 years ago, Soviet doctors told the Senatovas that Maria's case was hopeless.
I've heard some terrible stories about how cruel, really, they were to you.
Well, not only to me. They usually say that if a child is very sick, just have another child and forget about this one. So the same they told to me.
They told you to forget about this child?
Mm-hmm.
To try once more.
Yes.
And give this one
Try
up.
again and forget about this one.
Maria's mother told her story to Joanne McGowan, an American who is organizing a film festival in St. Petersburg.
There was no treatment available anyplace in the Soviet Union for these small children. So we decided we wanted to help.
McGowan was so outraged that she arranged to have Maria flown to the Oakland Children's Hospital, where heart specialists repaired her heart for free. News of Maria's surgery prompted a flood of letters to McGowan from other Russian families whose children needed surgery. So McGowan and the doctors and nurses from Oakland decided to come to St. Petersburg to start this cardiac center for children.
Did you mind these Americans coming in telling you how to do things?
It was very strange. We tried to understand for what purpose did they come? What did they want? And then I realized they wanted to help us, and that's all. It was very unusual.
So there was suspicion.
It's so unusual for Soviet people to think that somebody want to help you without expecting something from you. We've never seen it before.
One way Joanne McGowan tries to help is by raising money to buy medical supplies.
They don't have stethoscopes. They don't have the barest supplies, pharmaceuticals, drugs. They have nothing.
The Russians reuse syringes, even the disposable plastic ones brought over by the Americans. They make their own bandages and clean and reuse gauze. There's also a shortage of nurses, so family members stay with their children and cook for them and even clean the floors. More serious is a shortage of blood. When we were there, a patient needed an emergency transfusion. A Russian doctor rolled up her sleeve and donated blood on the spot. But there was no way to help this little girl. She had a simple heart surgery and was recovering well when an infection set in. She needed an antibiotic, but none was available, according to intensive care nurse Kathy Fleischman.
And it was something very simple that we take for granted. We call our pharmacy and ask them to deliver it, and they have none in the city.
They have no antibiotics in the city of St. Petersburg.
They couldn't get any.
A week after we took this picture, the child died from the infection.
Blood's on.
The Americans have donated millions of dollars worth of high-tech equipment to the program. So now there's one pediatric intensive care unit in St. Petersburg with several monitors and other sophisticated machines. But Dr. Hardy took us to see what most Russian intensive care units look like.
The difference between that unit and this is so stark. And this is what you saw when you first came. This is what the whole place looked like.
This is what all the intensive care units look like. There are 2 babies in here now, and as you can see, there's no monitors on the wall.
Now, tell me about these kids. They're tied down by their wrists.
Right. Part of that is, you'll notice that bed doesn't have any side rails. It's just a flat bed, and this is a baby who's old enough to be able to roll over and fall out, so they have to restrain them because they don't have enough personnel at the bedside to watch them.
Well, there should be a crib for
It should be a crib for that baby. Yeah.
And that baby.
It's pretty amazing. I mean,
this is a children's hospital, and they don't have cribs.
This is a children's hospital.
And on top of everything else that they don't have.
Right.
The shortage of supplies, poor working conditions, the lack of money are driving doctors out of Russia. 2 doctors trained by Heart to Heart in the last 2 years have already left to look for better paying jobs in the West.
Are doctors respected? Are you highly paid?
Oh, not highly. Bus driver is paid more than me.
A bus driver is paid more than a cardiologist in this society?
As a chief cardiologist.
Can you tell us what you earn in American money?
My month's salary is about $7.
You earn $7 a month?
Yes.
But here you're being trained by Heart to Heart. Do you think you'll leave one day?
Maybe.
There are about 50,000 children born with heart defects every year in the former Soviet Union. The Heart to Heart team can only operate on a dozen or so during each 2-week visit. The doctors tell us the hardest part of their job is choosing which kids get a chance to live and which don't.
It's a constant struggle. And it's the worst struggle because you know that it wouldn't be the same in the United States. You know it would never happen that way.
Now that would eat away at me.
It's hard. You want to put all of them in your suitcases and bring them home. Yet that's not a reality either. That's not what's going to help the system over here.
What helps the system is teaching the Russians to do the surgery on their own so that eventually they can become self-sufficient. That means this little baby won't be saved because the operation he needs is too complicated to teach the Russians right now. But Sasha Molchanov was chosen. He had one of the most common types of heart defects, one the Americans want to make sure the Russians become proficient at repairing.
You're all set?
So many doctors and nurses from Oakland want to work on this project, they now have to compete to join the team.
Okay, vein retract.
Back home, what they do is usually taken for granted.
So.
But here, they say, they are literally giving children life. Children who would otherwise die.
He's doing very well. There were no surprises. Everything was as
Sasha's surgery was successful, and his parents were brought in to see him after he came out of the operating room.
Tell Mother she's supposed to smile instead of cry. He's doing so well.
Because of happiness.
After the Heart to Heart team's 2-week trip was over, we went back to the hospital to get a last look at some of the patients. Alexander Panushkin, who could barely stand before surgery, was standing tall now, blowing bubbles. And Sasha Molchanov was discharged from the hospital. He was on his way home with a healthy heart and a normal life expectancy. The Russian government announced this week that doctors' salaries will be more than doubled, and that's good news for Dr. Mark Silberman. But meanwhile, the Heart to Heart organization has so little money, it's possible the American doctors and nurses may have to cancel their next trip to St. Petersburg.